Stress syndrome. Definition: it is a lung syndrome that causes inflammation of the lung parenchyma, leading to impaired gas exchange, with a systemic release of inflammatory mediators, causing inflammation, hypoxemia, and frequently multiple organ failure. This condition has a 90% death rate in untreated patients. With treatment, usually mechanical ventilation in an intensive care unit, the death rate is around 50%, but advances in treatment using prone positioning sessions while the patient is mechanically ventilated have reduced mortality rates to about 25%. A less severe form is called acute lung injury, or ALI. The acronym ARDS formerly signified adult respiratory distress syndrome, to differentiate it from infant respiratory distress syndrome, which occurs in premature infants. However, as this type of pulmonary edema also occurs in children, ARDS has gradually shifted to mean acute rather than adult. The differences from the typical infant syndrome remain. Signs and symptoms. ARDS is an acute injury to the lungs that results in alveolar flooding, atelectasis, and severe oxygenation defect, but it is not due to heart failure. It is in its early stages. It can cause shortness of breath, dyspnea, increased rate of breathing, tachypnea, and low oxygen saturation or hypoxemia. ARDS is characterized by the following criteria: lung injury of acute onset with 1 week of apparent clinical insult and progression of respiratory symptoms. Bilateral opacities on chest imaging not explained by other pulmonary pathology. Respiratory failure not explained by heart failure or volume overload. Decreased arterial pressure and 2 FIO. Cause. The predisposing factors of ARDS are numerous and varied: sepsis, multiple blood transfusions, pulmonary contusion, aspiration of gastric contents, and drug abuse or overdose are common. Also, burns, pancreatitis, smoke inhalation, pneumonia, and near drowning can cause this condition. Diagnosis: an arterial blood gas analysis and chest X-ray allow formal diagnosis. Although severe hypoxemia is generally included, the appropriate threshold defining abnormal PaO2 has been systematically studied. A severe oxygenation defect is not synonymous with ventilatory support. Any PaO2 below 100, generally saturation less than 100, on a supplemented oxygen fraction of 50% meets criteria of ARDS. Treatment: acute respiratory distress syndrome is usually treated with mechanical ventilation in the intensive care unit. Ventilation is usually delivered through oropharyngeal intubation or by tracheostomy whenever prolonged ventilation, 2 weeks, is deemed inevitable.